Okay, so today we're going to dive into something um,
Yeah.
really sensitive and honestly kind of heavy.
Yeah.
We're talking about the right way for professionals to
Yep.
handle,
Mm.
gender-based violence
Hmm.
and especially sexual assault and abuse.
Yeah.
We've got this certification course material for gender-based violence specialists,
Mm-hmm.
and it's pretty intense.
It is. Yeah. It covers a lot.
It covers like everything
Like everything.
from like what even is sex versus gender
Yeah.
all the way to, immediate safety steps,
Yeah.
how to take a history,
Mm-hmm.
reporting procedures,
Confidentiality.
confidentiality,
Forensics.
forensics even,
It's a lot.
and the importance of professionalism.
Yeah. Huge.
So our
I
goal
know.
is to,
Our mission.
our mission is to like
Extract all the
extract it,
good stuff.
the juicy bits.
Yeah. And the practical insights
Yeah.
so people can actually use this stuff. 'Cause-
Exactly,
yeah.
because this is important stuff.
Oh, absolutely. This isn't just like some theoretical,
Right.
textbook thing. It's
Yeah.
about like
Real life.
real people
Yeah.
and understanding the nuances.
Okay, so
Yeah.
let's start at the very beginning
Okay.
with the basics.
Yeah.
Um,
The words themselves.
yeah, the words. Like
Yeah.
when we say sex
Hmm.
and gender,
Yeah.
what do we even mean?
Right. And this is where Dr. Matthews' work comes in.
Okay.
They make this really clear distinction.
Okay.
That's super important for like the bigger picture.
Got it.
So sex biologically determined, like chromosomes,
Chromosomes.
anatomy,
Right.
like the physical stuff.
Got it.
Gender
Yeah.
is totally different.
Okay.
It's all about the roles,
Yeah.
behaviors,
Okay.
expressions, identities
Right.
that society kind of like,
Puts on people.
ascribes to different groups.
Right. And that can change.
And it does change
Okay.
across cultures
Right.
over time.
Right.
It's not fixed.
Which is interesting because I feel like that's kind of a newer idea.
Yeah, it's something that we're understanding more and more as
All right.
we learn.
Sure.
So it's important to keep in mind.
And that leads perfectly into the idea of,
Sexual assault.
sexual assault and abuse.
Yeah.
Like, what are we really talking about here?
Right. At the core.
Yeah.
It's about power
Okay.
and control.
How? So
They're committed without consent.
obviously,
Yeah, it's like a fundamental violation of
Right.
someone's autonomy.
their ability to choose.
Exactly. And their well-being.
Right.
So it's not just about like,
Defining
a definition. It's understanding
the why
the why of it.
and how that power dynamic like plays out.
Exactly. Like, how does that imbalance manifest?
Yeah. Are there like subtle ways
Oh, yeah. Totally.
that it can show up
Hmm.
that maybe we don't even realize?
That's a really important question to ask.
So then the course makes this distinction
Oh, yeah.
between survivor
Right.
and victim.
Yeah. What do you think about that?
I think it's important.
Yeah.
I think it shows like how
Their agency.
the agency, yeah.
Yeah.
But tell me why the course makes that distinction.
So survivors generally refers to
Okay.
people who've experienced,
Sexual assault.
sexual assault or abuse.
Okay.
And they're actively seeking help.
Okay, so
They're
bonded.
taking that step.
They're taking action.
Yeah. And it emphasizes their resilience.
Right.
Their strength victim.
Yeah.
While also accurate.
Right.
Might be used for people who
Have experienced it,
I've gone through it,
but maybe haven't.
sought support yet.
Yeah, or don't identify with that term.
Exactly.
Maybe.
It's all about the language
Yeah.
and how it shapes our thinking
Right.
and this idea of a
Survivor-centered.
survivor-centered approach.
Yeah.
That's key.
That makes sense.
Yeah.
So then the course talks about this thing called leave,
Leave.
which sounds
Yes.
hiddery catchy.
Yeah. It's a practical,
Yeah.
like a really practical guide for those first responders
Yeah.
and healthcare professionals.
Right when something happens.
Yeah. In those crucial moments.
So what is it?
It's a mnemonic
Okay.
that gives you like step by step.
A framework.
Yeah. A framework for what to do.
Okay.
So L,
Okay. L is for.
identify and treat
Yeah.
immediate injuries.
Okay, so that's like
Priority number 1.
triage.
Exactly.
That's it.
And the course really stresses this.
Oh.
If there are urgent medical needs,
Okay.
those come first,
These are-
even before forensics.
Interesting.
Yeah.
So life over.
Evidence.
Yeah, exactly.
I is for a complete history and physical examination.
So this is like a.
It's more than a routine checkup
Right.
because you gotta be so sensitive,
Right.
non-judgmental.
Recognizing the trauma.
Absolutely.
That's tough.
It is.
What kind of questions do you think would be good here?
I think open-ended questions are key. Not like leading questions.
Yeah, or accusatory ones.
Yeah, you're right.
It's about giving them space
Yeah.
to share on their own terms.
To tell their story in their own words.
Exactly.
And we have V.
V is for assess their emotional state.
So
Just-
trauma can manifest in a lot of different ways.
Oh, yeah, so many ways.
Yeah.
Shock, fear,
Withdrawal.
anger.
Yeah.
Recognizing that is
Yeah.
huge.
Yeah, because you don't want to...
Misinterpret.
Yeah, you don't want to think they're being difficult when really...
They're just traumatized
Yeah.
and needs support.
Okay.
There are 2 E's, actually. The
Oh,
first one
Okay.
is for post-exposure prophylaxis.
For HIV.
PP, yeah.
Okay.
So offering that within 72 hours reduce the risk of transmission.
So it's like a time-sensitive
Oh, yeah, very.
medical intervention.
Yeah.
Okay, and the second E,
The second E is all about consent.
informed consent.
Informed consent.
That before any examination or evidence collection.
So they have to understand what's happening
What's being proposed
Yeah.
and agree to it
freely.
freely. Yeah.
Do you think that's hard to get in those situations?
I mean, think about it.
Right.
Someone's just experienced this trauma.
Right.
Are they really in the right headspace?
To make a clear decision.
Yeah, it's a huge consideration.
Yeah.
Professionals have to be so careful.
To make sure that the person is actually able to consent.
Exactly.
Okay. And then finally screen.
Just create a safe environment.
Like a physically
Safe,
Yeah.
private, distraction-free,
Yeah.
where they feel
comfortable,
right
secure.
as possible
Yeah. Because building that trust
is key
is everything.
to getting them to open up.
Yeah. To share.
So after those immediate steps,
Lay.
what's
And the course goes into,
history taking?
yeah, a comprehensive history.
Yeah, like in detail.
Dr. Matthews says that a thorough history is really important for a lot of reasons.
Yeah.
Obviously for medical care,
Right.
psychological care,
Mm-hmm.
but also for,
Potential legal stuff.
yeah, forensic documentation.
Down the line.
So this is where those open-ended questions are so important.
Let them tell their story
Yeah,
at their own pace.
right. It's not about
Interrogating.
Wow.
It's about facilitating their narrative.
and observing
observing everything,
That
their
is-
mental state,
how they're talking.
their mood, their speech,
Their effect.
their thought processes.
And being
Non-judgmental.
Yeah, absolutely.
That safe space is everything.
What about things like pregnancy risk?
Oh, yeah, that's part of it, too.
Okay.
Assessing that risk
And
of
offline,
emergency contraception,
if it's appropriate.
if they want it.
Right.
And it's important to,
Connect them with resources.
yeah, like medical.
Toxicological. So they have options.
Yeah, for sure.
So now we've got this history,
Mm-hmm.
and then comes the whole
Reporting. that.
reporting thing.
It's tricky.
It's so tricky.
You've got ethical consideration.
Legal stuff.
Yeah.
And most importantly,
The survivor's wishes.
exactly.
Yeah.
So how do you balance all that?
Right. Well, the course says
Yeah.
forensic evidence can be really important.
Right.
But the survivor has to consent.
To having it collected.
Yes, before anything happens.
So again, it's about their
Their choice.
autonomy.
Yeah.
And what about mandatory reporting?
So the course says medical professionals,
Yeah.
they don't always have a legal duty to report every case.
But they
have to document
They always have to document
everything.
everything, because what if the survivor
Decides to
pursue legal action?
later.
Yeah, that documentation is crucial.
I also noticed that the course mentions having a chaperone.
During medical exams,
Yeah.
that's standard practice.
Why is that?
It's ethical,
Okay.
it's professional,
Okay.
it adds another layer of support
Mm-hmm.
for the survivor,
Okay.
and it helps prevent misunderstandings. Okay, so it protects both.
Both the survivor and the provider.
Makes sense.
And of course,
Confidentiality,
confidentiality is key.
like super important,
You can't overstate it
because,
because it builds trust.
yeah,
It encourages people to seek help.
exactly,
They have to know they're safe.
to share.
Yeah.
So to kind of illustrate all these concepts,
Right.
the course uses this case study.
About Jane,
Yeah.
a fictional survivor.
So how did that help?
It showed how all the different professionals,
Like
healthcare, mental health,
mental health,
legal advocates,
all work together.
it's a team effort
It
to
is.
support the survivor.
Exactly.
So we see how they address her immediate needs,
Medical.
psychological,
Yeah.
and then how all the systems work together to
Isolated
heal.
ongoing support.
Yeah.
It's all connected.
Yeah. Now, the outline also mentions that the case study helped illustrate these 4 key conditions.
For forensic evidence.
Yeah, for it to be admissible in court. Even though the course didn't list them out specifically,
Yeah.
it probably showed us how
Like procedurally.
procedurally,
Yeah.
how the evidence needs to be handled
Right.
to be considered valid,
So for custody,
proper collection.
to prevent contamination,
Because if those things aren't done right,
it's not admissible.
and then you can't.
Use it in court.
Yeah, and that could be the difference between,
Justice being served
yeah.
or not.
And I'm guessing the Jane case study also really drove home the importance of,
Empathy.
Yeah.
Like in every interaction
yeah,
with the survivor.
and in the documentation.
yeah, that sensitive
Like,
documentation.
about really seeing them
And recognizing their trauma.
and responding with compassion
Yeah, and every aspect.
of care and support.
Yeah.
Then finally the course ends by talking about,
Professionalism
yeah,
and accuracy.
in documentation.
It's crucial
Yeah.
Because that documentation serves so many purposes. It ensures continuity of care.
If multiple professionals are involved,
Right.
it's a reliable record of
Yeah.
their account.
And any medical findings.
Yeah,
And for legal proceedings.
it's vital.
So the course specifically says to be careful with the word rape
Yeah.
and to only use it,
When there's enough evidence.
forensic or legal evidence,
Yeah.
otherwise
Due to the facts.
objective language
Yeah, descriptive.
for injuries and
Yes,
findings.
exactly.
So no assumptions, just the facts,
Just what you can see.
and then clarifying.
Clarifying the survivor's statements.
Yeah, to make sure you're getting it right
Yeah.
and not misinterpreting anything.
And the course also mentions
Yeah.
people like Nuhu Hamda Hajara and Sarah.
Who were they?
They were participants in the course.
And they were really engaged.
Yeah. Asking great questions.
It showed
Deeper understanding comes from.
engagement.
Yeah, and considering all sides,
Yeah.
different perspectives.
So to wrap up this deep dive, there are a few key things that really stand out.
It all comes down to
Yeah,
the
well-
survivor putting them first.
Yes, survivor-centered care,
That's the guiding principle.
their needs, their safety, their choices,
Absolutely.
and that live mnemonic
Is so helpful.
for those first moments.
Immediate safety.
Yeah.
Immediate care.
Thorough history taking
So important.
for support and for legal reasons.
Mhm.
Ethical reporting,
Yeah.
confidentiality,
Huge. You
Yeah.
can't mess that up.
and the case study.
Showed us how.
Yeah, how all the different parts work together
And how important it is to follow the rules.
for the evidence.
Yeah.
And then, of course,
Professionalism, all documentation.
yeah, you got to get it right.
For ethical and legal reasons.
This has been really eye-opening, this
Yeah.
whole deep dive.
It's a lot to take in.
Yeah, it really shows you how complex this all is
And important
and important
to handle it right.
with training and care.
Absolutely.
So I think anyone listening who wants to be more informed about,
Gender-based violence
yeah, and especially sexual assault and abuse,
should really think about this stuff.
this information is so valuable.
Yeah, and it makes you think
Yeah, about the responsibility.
of balancing the needs of survivors
Yeah,
with all the legal and ethical stuff.
it's a lot to balance.
It is.
So what do we do with this information?
Well, I think it's a call to action.
Well,
Look at our own communities
Yeah.
and see what resources are available
For survivors.
and how we can all contribute.
to being more aware
Yeah.
and responding more effectively.
To gender-based violence.
It's not easy,
No.
but it's so important.
Yeah, it really is.
So thanks for taking this deep dive with me.
Of course.
It's been,
Intense.
yeah, but really important.
Yeah.
So,
Until next time.
yeah, keep learning, keep exploring,
Be
and
kind to each other.
always.
Yeah.
Okay.
Okay.